Hi, friends. I have Rose Lang joining me for a chat about the Parkinson's Foundation's Aware and Care Kit. Rose is a Parkinson's Foundation ambassador, and she is a care partner to her husband, who was diagnosed with Parkinson's in 2008. Rose is a retired pharmacist after 43 years of working in that field, the last 26 years of which included hospital, retail, and mail order pharmacy. Rose also served as the vice president and general manager of the CVS Caremark mail order facility in Pennsylvania. Rose, thank you for joining me. I'm sure with both your professional experience plus being a care partner that you know firsthand of the challenges a person with Parkinson's may have with any hospital stay, planned or unplanned. Can you share more about your experiences in this regard and how they help steer you to becoming an ambassador with the Parkinson's Foundation?
Certainly. And thank you, Charlotte, for inviting me to be with you today. I think my path to become an ambassador actually started with our retiring and moving to the Villages, Florida. We were very impressed with the Parkinson's Community Support Network that's here in the Villages, as well as the fact that we're so close to a Parkinson's Center of Excellence in Gainesville. I think I first got interested when I attended a Parkinson Foundation seminar. And I thought that my experience in healthcare as a pharmacist and understanding medications would be a great transition into being an Aware and Care ambassador. So actually, what we do as ambassadors is that we educate and counsel and empower people with Parkinson's and their care partners on how to live well with disease, and especially have an emphasis on staying safe when hospitalized. Another thing that we do is try to educate healthcare professionals, because there isn't any professional out there that can know everything about every disease. So what we try to do is to educate nurses, doctors, therapists, dentists, people that run assisted care facilities on the unique needs of the Parkinson's patient.
Mm-hmm.
So before we actually start, talking about the Aware and Care Kit, which is really the toolkit that's the easiest way to educate people, I just wanted to talk a little bit about Parkinson's in general, because 1 million people are living with Parkinson's in the United States, and 90,000 will be diagnosed this year. Mm-hmm. The reason these things are so important with regard to hospitalization is that a person with Parkinson's is 44% more likely to be hospitalized than their peer counterparts without Parkinson's. And when they are hospitalized, they experience longer hospital stays, sometimes 2 to 14 days. So when this happens, if we can think of it like if there were 12 people with Parkinson's, then 4 of those 12 would be hospitalized this year. And 3 of the 4 would not receive the right medication on time. And of those 3, 2 would have complications as a result of this. And when we say complications, we mean exacerbation or increase in symptoms, cognitive issues, longer hospital stays, mobility problems, and overall just healthcare outcomes that are not positive. So since our biggest concern is medication and receiving the right medication at the right time, you might say to yourself, how can that possibly happen in a hospital? But I want to talk about some of the ways that that does happen. The first is the medication can be the medications are missed accidentally. Say the patient is admitted to the hospital for something other than Parkinson's, maybe through the emergency room, a stroke, a heart attack, an accident, or they simply are not entered into the computerized system in the hospital. So there's no identification of this patient as a Parkinson's patient. The second thing can happen when medication is knowingly withheld, but not necessary to do that. For instance, a patient who would be designated as NPO or nothing by mouth, maybe they had to go to surgery, then they believe that that applies to the Parkinson's medication as well, but it does not. A Parkinson's patient can receive medication with a small sip of water up until the time they have surgery.
Okay, that's
One
good
of
to
the
know.
other, yeah, one of the other issues is that Parkinson's patients often have dysphagia or swallowing problems. So sometimes medications are withheld because of that. Probably one of the most important issues is that medication is delayed and not delivered within the time frame that the patient is used to it in their home schedule. And this can happen for a number of reasons. Perhaps the hospital is out of the medication, or the fact that they're on a hospital distribution time. It's a hospital protocol. Having been a hospital pharmacist, I understand why this is a challenge. But in a hospital, it's considered on time if you're an hour before the designated time or an hour afterwards. So that can really cause a problem for the
Right.
Parkinson's patient.
Mhm.
And the last thing is that the patient may not receive the medication that they're used to receiving. Again, either because the hospital is out of it, it's not listed on the formulary, or an improper substitution is made. For instance, an extended release tablet instead of an immediate release tablet, or a generic instead of a trade name product. So all of these things complicate the issues. So with that as the background, we could start to talk about what's in the hospital kit to help fight these issues and these challenges and to meet challenges when you're hospitalized.
Mhm.
Okay, so we can start with the medical alert bracelet and the ID card.
Okay,
And this is important to have in an emergency because it alerts healthcare professionals that you are a Parkinson's patient. And it also provides pertinent personal information and what medications to avoid. So this is very helpful. And the magnet that's also on there, which says, you know, I'm a Parkinson's patient, I need my meds on time every time, is simply a reminder that you can put in the hospital room to let people know that you are a Parkinson's patient. The hospital action plan. This is a review to prepare the patient for a hospital stay, either a planned stay or an unplanned stay. And it's really valuable for anyone to review, whether you have Parkinson's or not, because it does have a checklist that you can go through when you're preparing for the hospital stay. And it also emphasizes some safeguards while you're in the hospital. The other is the medication form. This form is in the kit, but it can also be downloaded from the website and printed. That's very convenient because if the doctor changes the meds or discontinues some medication, it can be easily edited and so that it's always up to date. And this medication list also contains personal information, the information, identity, and contact information for the patient's physician, and any other special considerations that should be taken into account. The hospital letter was actually designed by the Parkinson Foundation during COVID. And the purpose of it was to alert healthcare staff as to the unique needs of the Parkinson's patient and why it was important for the advocate to remain with the patient and also to provide their meds if they were not available from the hospital. In addition to that, the letter contains a lot of additional information about medications that should be avoided or issues that could cause a negative effect. There's also a reminder that no changes should be made in the patient's drug regimen unless the neurologist is contacted. And the neurologist's information is listed at the bottom of the letter with their contact information. The next thing is the hospital care fact sheet for nurses and healthcare professionals. And this is actually a tear-off pad so that you can distribute the sheets easily enough. And these sheets provide very vital information about Parkinson's regarding medications to avoid, as well as safe alternatives to those meds, and also critical care information with regard to the patient, common symptoms that would be experienced in typical Parkinson's medication that a patient might receive. The information cards regarding DBS, which is deep brain stimulation, and the Duopa pump. This is important because some patients do utilize these specialized devices in their care, and safeguards have to be followed in the hospital with regard to them. So they provide general information and 800 numbers that are available 24 hours a day so that healthcare professionals can contact with the experts with regard to these devices.
What do you feel is the most invaluable item in the Aware and Care kit?
Well, I guess if I had to pick just one item, I would probably pick the hospital care fact sheets, because those really are the key communication tool for the advocate and the patient while they're in the hospital, to provide anyone with general information that the patient is going to come in contact with during their care.
In order for someone to be fully prepared, what medication should the person with Parkinson's carry in the Aware and Care kit?
Well, essentially, we should focus on the Parkinson's meds as far as what is going into the kit. And in this way, you're always prepared to maintain your at-home drug regimen, regardless of the circumstances, emergency, time of day, maybe the hospital is out of the medication. You're always going to have it available. Of course, any medications that are in there should be properly labeled. So we suggest they use the original pharmacy medication bottle that has the proper label, the name of the drug, the strength, the dosage form, and the frequency of use. Of course, some Parkinson's patients may not, they may take more than one medication. You know, the most common one is the carbidopa, levodopa, but there are other medications that are used to treat, treat Parkinson's. You should probably have at least a week's supply, because that'll cover you in case of any, emergency. I suppose if a patient had a heart condition or was a diabetic, they might want to put those other medications in, but those are normally readily available in a hospital environment. So we really don't stress that as much.
Okay. We know how important it is for those of us with Parkinson's to take our medications on time every time. So the Aware and Care kit is beneficial with providing resources to help educate healthcare providers during the hospital stay. But is it difficult to get permission from medical staff to allow us to take our own medications?
Well, that's probably the most challenging thing if you come up against this in the hospital, where they may not have the medications or there's a delay in getting them. But the whole idea is to educate healthcare professionals on how important that is for the Parkinson's for the Parkinson's patient. So unfortunately, the explanation has to be that there can be some very serious side effects for the patient if they don't receive their meds. But when we go back in time to Florence Nightingale, she said the role of the hospital is to do no harm. So we don't want the Parkinson's patient to come out of the hospital worse than when they went into the hospital. So the hospital letter can really help with that effect, because that is an explanation by the foundation as to why it is so critical for the Parkinson's patient to have their meds, and why an advocate or care partner should be allowed to administer those meds should they not be available. Take some convincing.
Right. Now, if a patient is denied the request to manage their own medications, what assistance or resources are available at the hospital to have that decision reevaluated?
Okay. Well, first of all, we hope that they'll have the meds and that they'll be delivered on time.
Right.
And we mentioned the hospital plan, and it does talk about safeguards. When you're a hospital patient, you do have rights as a patient, and you do have resources in the hospital. There is a case manager. Everyone admitted to the hospital has a case manager, whether you know that or not.
Right. I wasn't aware of that, so that's helpful.
A social worker and a patient advocate. And my advice is to ask who these people are and contact them as soon after admissions as possible. First of all, you can set your expectations with these people. And you can also get their contact information should an issue arise later during the hospital stay, that you have someone to consult with.
Oh, okay, that's good to know.
Mhm.
From your experience, do you find people feel intimidated in approaching medical staff about their Parkinson's concerns during a hospital visit?
Right. This is probably the most frequently asked question that I get when we give seminars to patients and their care partners. Of course, they feel it's easier for me to advocate for a patient in the hospital because of my healthcare experience and my
Right.
experience with medications and familiarity with talking with doctors.
Yeah.
However, that's the beauty of the Aware and Care Hospital Kit, because it's actually designed to be an educational tool. And the information in there helps to enable the patient advocate or the care partner to present the material to the healthcare professional in a way that it enables them to see the patient through the perspective of the disease. So if they can understand Parkinson's, then they can understand why the need for the patient is so critical. So anyone can say, I'd like to give you some information from the Parkinson's Foundation that may be helpful for you to understand the challenges that we're facing. We're particularly interested in having his or her medication on time every time, because there's side effects and problems that can arise whenever there's a change in the schedule. And you can read all about that in this information from the Parkinson Foundation.
Right, right.
I mean, it's kind of basic that you would say anyway to a person. Another thing is they're always going to ask for a current medication list. So
Okay.
as I mentioned in the kit, there's a list there, or you can download it off the site. And what I usually do is I attach the hospital letter to the medication list, right? The hospital
Okay.
letter and the medication
Okay.
list. So when they ask, it's just another opportunity to reinforce that it's a Parkinson's patient. So, and you can also add, and there's some additional interesting information here that may help minimize any issues during our hospital stay. So you have two opportunities to present that. And I will say one other thing. If the patient is going to have surgery, it's very important to speak to the surgeon and the anesthesiologist before the surgery. They're going to come in the room anyway, and they're going to say, do you have any questions?
Right.
And you're going to say, yes, I have a question about general anesthesia, because typically Parkinson's patients have cognitive issues as a side effect of general anesthesia. So you could ask the surgeon, is it possible to use perhaps spinal anesthesia, or minimally, could we reduce the dose and use the minimal dose to help to minimize the side effects? And the anesthesiologist is always going to pre-medicate the patient as well. So you might want to ask what medications are going to be given so there won't be any problems with that.
Okay. All right. That's helpful. How important is the care partner's role in a person with Parkinson's hospital stay?
Well, I'd say it's critical, because so often the patient may be confused or cannot communicate what their own needs are at the time as things occur. And, in a hospital environment, things change quickly. The environment changes, the patient's condition changes, the shift changes.
Right.
So sometimes you've got to start all over again with new people. But I think it's also reassuring to the Parkinson's patient that they know that if they go to the hospital, their advocate is there to address issues that come up when they cannot address them themselves.
Yeah, definitely, definitely. I think as a person with Parkinson's, I'd have enough on my mind.
Exactly.
Just being in the hospital.
Share the burden.
Yeah, that's right. Should the person with Parkinson's neurologist or movement disorder specialist be contacted of a hospital stay if it's unplanned, or is it okay to follow up afterwards at the next scheduled appointment?
Well, I think it's always important to notify the neurologist up front. And that's fairly easy these days. Most neurologists have some type of digital communication available, or we have like a portal system. I know where we go at the Fixel Institute, and I can communicate very easily with the neurologist. And it's important from another standpoint, because should there be any reason to have a consultation while the patient's hospitalized, it's nice that the neurologist has a heads up on what the situation is. I know my own experience when my husband suffered a broken hip during COVID. The first person I contacted was our neurologist, and she answered me back with a whole list of things that I should be aware of, concerned with, and to check on. So it's very reassuring to have that support during hospitalization stay.
And you brought up a good point about the portal. I think a lot of physicians' offices are tapped into the portal type communication system, where you can see your test results and appointment reminders. So that's a helpful reminder too, because I don't often think about it, but you're right. That's a good way to get in contact.
The patient should try to, or the patient and the caregiver should try to familiarize themselves with the system before you need it. Because that way you'll feel comfortable in using it.
Definitely. Is it easy to reorder items in the Aware and Care kit, like the hospital care fact sheet and medication form?
Yes, it is easy to reorder. Of course, you can order the kit directly from the foundation. They're free of charge, and there's a small delivery fee attached to that. But otherwise, you can get updates on the printed material, and also all the printed material can be downloaded from the website. So I think that they do not individually replace the bracelets or anything like that. But otherwise, any printed material, so that you always have the most updated information.
Okay, that's good. So the Aware and Care kit is a great resource. I have one, and I carry one with me when I travel, so I have everything in one place. Are there other times where the Aware and Care kit can be useful?
I would say yes. My advice is don't leave home without it, especially if you are traveling, as you've mentioned, that you want to be always carrying that in your luggage that you have with you, rather than checking anything, so that you'll always have the meds. But I advise patients that they should take their Aware and Care kit to any visit that they have with a healthcare professional, whether it's your cardiologist or a physical therapist or your regular internist, because they also are always going to ask you for the updated medication list. So once again, you attach that hospital letter, and you've got the opportunity to remind them this is a Parkinson's patient. And also, it's a great opportunity for us to continue to educate healthcare professionals on these, unique needs of the patient. So I say, take it every place you go. And you never know when something's going to happen. Expect the unexpected. You can stumble on a curb and break your leg, and here you are.
That's true. That's true.
You never know.
What other information and resources are available from the Parkinson's Foundation?
Well, the foundation has a helpline, and that's an 800 number that's available to answer any questions. And when you reach someone on the helpline, you get a nurse or a social worker or a healthcare educator, a Parkinson's educator, so that you're going to get valid information. And if they don't have the answers, they'll help you, lead you to someone who can answer those questions. It's 1-800-4PD-INFO. And also, say you're on the website and you can't find something you need, they'll walk you through that as well. So that's one great resource that you can connect with a real life person and get some help. The other thing is, of course, there's a number of fact sheets and booklets that you can order from the foundation, or that you can download to your own computer. So you have them. There's webinars, podcasts, expert briefings, exercise videos, all kinds of resources that you can take advantage of right in your own home. So it's a wonderful resource. And I would say There are other national organizations, Michael J. Fox and Davis Finney Foundation, that also have wonderful websites that are very, very helpful.
A lot of resources available, so that's great.
Mhm.
If someone is interested in volunteering with the Parkinson's Foundation, what is involved and what steps should they take to apply?
Okay, well, they can go to the website parkinson.org/volunteer. And that takes you to this area of the website that I think will ask you to fill out a volunteer interest form. And then they can contact you. And the foundation does do online training for volunteers. And there's a lot of ways that you can volunteer for the foundation, not just as an ambassador, but you can participate in moving day events, fundraisers. You can volunteer for some of the not experimental, but some of the clinical trials that are out there.
Right.
So there's a lot of information and way out there for volunteers that you can, take part of, as well as contributing to the foundation.
So in closing, what advice would you give someone who's newly diagnosed?
Well, I'm glad you asked that question because the Parkinson's Foundation and other organizations as well have kind of outlined some steps that newly diagnosed patients should consider. And when we say newly diagnosed, we're really referring to people within 1 to 5 years from the initial diagnosis, because initially they may not even experience a lot of symptoms. So there isn't that keen awareness of need at the beginning. And it's sometimes very hard to get information from physicians about Parkinson's. The first thing I would say is to seek expert medical care, preferably with a movement disorder specialist, although there are not a lot in the United States and there are fewer in rural areas. But a movement disorder specialist is actually a neurologist with additional training in movement disorders. About 50% of Parkinson's patients are seen by a neurologist. So that means the remainder are seen by a regular physician. So it's very important to rely on expert advice, I think, early on.
Right.
The second thing is to educate yourself about the disease. And this includes the patient and the care partner. There's really so much out there, like we're talking about all the resources that there are, seminars and websites and podcasts and programs like your own here on YouTube that really need to take advantage of. And the information initially can be a little overwhelming, but you need to stay with it because it allows you to make informed decisions along the way. The more you understand about what you're facing, the easier it is to make decisions.
Right.
So I think that's really important. And of course, establishing a support network and a care team is critical. Early on, you may just be seeing a neurologist, but eventually you may need to have the services of a physical therapist or an occupational therapist, a speech therapist, maybe a neuro-ophthalmologist, depending on what the issues are that arise. So it's very important that you think about that and plan and plan to stay in touch with this team. And also, when I talk about support groups, support can come in a lot of different ways. It can come online support or in-person support, or just staying active in your community. It's very bad for a Parkinson's patient to be isolated. You need to socialize and communicate in order to live well with the disease. Of course, the big thing is exercise.
Right.
And exercise is like medication for the Parkinson's patient. I mean, it's critical to maintain mobility. But the thing that people don't often think about is that it's also helpful in keeping non-motor symptoms in check. Things like depression, anxiety. If you're moving, it really helps those situations as well. And people will say, well, what's the best exercise? Well, that's the one that you do, right? So pick something that you do and try to do it regularly. And of course, you can't say advice without saying eat a healthy and balanced diet. That can be very critical for a Parkinson's patient. They often recommend Mediterranean diet, fruits, vegetables, unprocessed foods, not a
Right.
lot of sugar, all that. But and your doctor may suggest that you speak to a nutritionist at some point or a dietitian if there's, other issues.
Right.
But I guess the very last thing I would say is that it's important to understand that every Parkinson's patient is unique.
Mhm.
There's no two patients that are alike. There's no two patients that progress at the same level.
Right.
So I tell patients they should adopt the philosophy of Davis Finney, the Olympic cyclist and Tour de France winner.
Yep.
And this is what he said: I cannot change the fact that I have Parkinson's, but I can control the way I choose to live well with the disease.
Right. Right.
I think that's the best advice anybody can give.
Yeah,
Even
definitely.
for a caregiver. Yeah.
That's great. That's great advice.
Yeah.
I
It's a journey.
It definitely is. And I know as somebody, I'm new, I've just been diagnosed just over 2 years ago. So I am seeing a movement disorder specialist, but I have talked to other newer diagnosed people with Parkinson's who said, they don't feel they need a movement disorder specialist. They don't need a physical therapist. So to your point, they just don't feel they're at that stage yet to really look into these
Right.
resources. But I think it's important to, if nothing else, set up an appointment for an introduction, establish a baseline. Would you agree
Exactly.
with that?
I would. It's very important. That's why I love the Parkinson Center of Excellence, because under one umbrella, they do all of these things that you are seen initially by a physical therapist, by a speech therapist, by an occupational therapist. You have a swallowing test. It's just like going to a cardiologist and getting an EKG. You need a baseline to know where you are. In that way, on a regular basis, you can track if you're improving or if you need improvement, or maybe you need some additional professional help. Maybe there's balancing issues that were not apparent a year ago, but they are now. So a physical therapist can help with that. Prevention is very, very important with Parkinson's. And the more you exercise is the only thing that has ever been proven to delay the progress of the disease. It won't eliminate the disease, but it will delay the progress.
Right.
So it's important that people utilize physical therapists and other professionals as well.
So I've included the website and phone number to the Parkinson's Foundation on the channel's community page. If viewers would like to learn more about the Aware and Care Kit and order one, the kits are free. I believe there's an $8 shipping charge. I've also added the Parkinson's Foundation's contact information if anyone's interested in joining their team as a volunteer. Rose, thank you again for chatting with me. I appreciate your time sharing the information about the kit in order to help others be better prepared for planned and unplanned hospital stays. And thank you, friends, for supporting the channel and tuning in. So keep moving, stay positive, and I'll see you soon.
My pleasure. You too. Take care.
Thank you.